Welcome everyone to yet another webinar presented by Faculty of Dentistry of Masa University. I'm Dr. Shulagna Datta, Senior Lecturer in Physiology and Head of Research in the Faculty of Dentistry of Masa University. Today's webinar is very special to us. It is Telescopic Denture in Clinical Practice, presented by my friend and colleague Dr. Noor Adin Abu Arshid. He is a senior lecturer and specialist prosthodontist in the Department of Prosthetic Dentistry in Masa University. He is a beautiful human being and makes our smile more beautiful. Dr. Noor Adin has completed his Bachelor of Dental Surgery at the Faculty of Dentistry in Damascus University in 2005. He later continued his studies where he received specialist training in prosthodontics to obtain his postgraduate diploma in 2007 and master's degree in 2010. He is trained under leading prosthodontic rehabilitation specialists like Prof. Dr. Joseph J. Massad, Oklahoma in USA, and also Prof. Dr. Matthias Kern, Fredendorf in Germany. He has more than 17 years of clinical and teaching experiences in the field of prosthodontics and aesthetic dentistry. He is a senior lecturer now and specialist prosthodontist at the Faculty of Dentistry in Masa University, Malaysia. He is also a fellow of Puri Fauchert Academy in USA and a member of International College of Prosthodontists. It's my pleasure to welcome Dr. Noor on the podium. Welcome, Dr. Noor. The stage is yours.
Thank you very much, Dr. Solagna, for the nice introduction. And it's my pleasure to have my first webinar with Masa University. And today we are going to share my screen. Okay.
It's already shared.
Already shared. So today our topic is about telescopic denture in clinical practice. Actually, telescopic denture it's one of the excellent treatment options that we can offer it for our patients in our clinical daily practice. And today we'll have a look about this kind of treatment options or treatment modality, advantages and disadvantages, and also the indication and contraindication of this one. So let's get started. The learning outcomes of the webinar today, the audience should be able to understand the different classification of telescopic denture in clinical practice, and then justify the significance of using telescopic denture in clinical practice. The outline of the webinar will be having a short introduction about telescopic dentures, definitions and different types of telescopic dentures, advantages, disadvantages, indication and contraindications of telescopic dentures, plus some discussion about the clinical cases. So as an introduction, many treatment modalities are available for replacing missing teeth. As we know, we have removable dentures, fixed partial dentures or bridges, plus the dental implant. The choice between these several treatment options or modalities for replacing missing teeth is influenced by so many factors like clinical factors, the dentist competency, and patient's case. Clinical factors, it can be related to the long span of edentulous area and how many abutments we have, the dentist competency to do this kind of treatment options, or he needs to go for more further training, and the patient's case if he's a good candidate for this treatment options. Mr. Divan stated before that it's perpetual preservation of what already exists, which is very important, and not the meticulous replacement of what is missing. Dentures are often unsatisfactory for patients because they have always problem with their retention, especially if we have a severely resorbed ridge or atrophic ridge, especially the lower arch, or excessive tissue coverage. The patient will complain that it's too bulky. And regarding the implants, the patient cannot afford to pay the high cost of this kind of treatment options. They are very expensive and may require bone grafting for replacement, and maybe the patient will not be able to go for surgery. In other cases, there may not be enough teeth present to support a fixed prosthesis, especially if we have a few remaining teeth. And the patients will come and telling you, I need doctor to have something fixed in the mouth. I don't want any removable denture, otherwise you will feel older. So telescopic dentures here will come as an excellent options for these patients. So furthermore, patients who have lost teeth due to poor oral hygiene may suffer the same problems with implants and bridges. In such a cases, a removable prosthesis facilitate the maintenance of oral hygiene because the patients will be able to remove and insert this denture whenever he finish eating and we want to give rest for the gum, and the teeth will be protected. A telescopic denture provides an excellent alternative to overcome all the above mentioned problems. So what do we mean by telescopic denture? Telescopic denture actually is a prosthesis that combine the basic fixed concept and the basic removable concepts of prosthesis together, and it will consist of a primary coping, or we call it the inner crown, that is attached or cemented to the abutments in the patient's mouth, and a secondary coping that is already attached to the prosthesis or the denture, and it will fit properly and perfectly on the primary coping. The external surface of the outer crown or the secondary crown may have the anatomic shape of the natural tooth, or it may be a simple coping without anatomic landmarks. Actually, this one depends on the type of occlusion that we need to provide it to the patients. And also the retention is achieved by fitting the outer crown on the inner crown. Telescopic denture, also known by so many following terms. The most commonly used one is actually double crown, frictional fitting telescope with clearance fit. Each one it will be different. Like the fitting telescope, this one will get the retention by the frictional effect. The one with the clearance fit, this one is non-rigid, resilient. And also we have the Marburg double crown based on the German prosthodontist who invented this one. And we have the conus crown, which has proven to be a very effective means for retaining overdenture. So double crown actually can be used as a retentive system to increase the retention or provide retention for the removable partial denture, and also can be used as an attachment for overdenture. So what are the different types of double crown or telescopic denture? First one, we have the rigid type double crown, and here there is no clearance fit between the outer crown and the inner crown. That means that the outer crown will fit completely with intimate contact on the inner crown, and we need to differentiate here between the different shape of the primary crown. So the first one actually is the conical one, which is what they call the most commonly used one. Here, the outer crown will fit on the inner crown completely, and the retention will be provided by wedging effect when the outer crown completely sits on the inner crown. And actually here we can control the retention that we want to provide it for our denture by changing the convergence angle or the taper angle. So the more taper the inner crown be, the less retention we will get. Okay, so in this case, we provide the taper of 6 degrees. Sometimes we can provide between 4 to 8. So it depends. And the retention will be provided by wedging effect. And this one actually is less complicated to fabricate than the one which the second type, which is the cylindrical double crown. The second type, which is the telescopic double crown with the friction effect, here the retention will be provided by friction effect, and the inner crown or the primary crown will have a barrel-sided axial wall. So the secondary crown will fit with intimate contact on the inner crown with a friction fit. But the problem with this one, actually, by the time the retention will be decreased because of the wearing off of the secondary crown whenever the patient wants to wear the denture, insert it and remove it. And this is why it's very important, wherever it's possible, to fabricate these crowns with precious alloys like gold or noble alloys. Uh, and the good things about this type of telescopic crowns with friction fit, the retention will be very good, and the aesthetic will be excellent, especially at the marginal area. But one requirement for this telescopic double crown, we need to pick or choose the abutments that still strong and have a healthy supporting tissue, because the occlusal load, considerable occlusal load, will be applied on these abutments. So if it's not strong enough, then at the end it will cause some what they call lever of action on the abutments, and it will break down the supporting tissue. This is a second, another case showing how we use that telescopic double crown with a friction fit, replace some teeth. The third one, which is the galvanoformed or electroformed double crown. Actually, this one is a cylindrical type of double crown, but here the secondary crown will be electroplated, also indicated for patients who's having considerable resorption in the ridge, and the wear rate will be lower because usually the secondary crown will be fabricated using the precious alloy. The second type of double crown system is the non-rigid one, which is the resilient one. Here, it's simple. We just know that there will be a clearance fit between the secondary crown and the primary crown. So what does that mean? That when the outer crown or secondary crown fit completely on the inner crown, there will be a gap between the inner crown and the secondary crown. This one, we call it the clearance. The dimension of this clearance is 0.3 to 0.5 mm. And actually, the good thing about this one, it will allow some sort of freedom in movement in the vertical and rotational direction. And this one will distribute the stress more evenly, and it will harmonize with the tissue elasticity, and less harmful effect will be on the abutment. This is why this kind of system is indicated whenever we have a few remaining teeth, or the abutment teeth is periodontally compromised, or it doesn't have that healthy supporting tissue, like some sort of mobility. So the first type of this one, telescopic double crown with a clearance fit. Here we replace the missing teeth with only a telescopic crown on 3 abutments, and the retention here will be provided by making the third cervical region of the primary crown parallel with the outer crown, so the retention will be provided. Another type is of this non-rigid telescopic crown is the hybrid telescopic double crown with the friction pin. Here, the friction pin actually will slide all over a groove which already created on the proximal surface of the inner crown. And how we create this one, actually during the wax up, and we will get what they call the groove on the proximal surface of the inner crown by a spark erosion, this procedure. And then the friction pin will be attached to the inner surface of the secondary crown. How we will do that one? By using the laser welding. So the retention will be provided by this friction pin. The third type of this non-rigid telescopic crown is the Marburg double crown and TK snap. This one, actually, there will be a button will be attached to the inner surface of the secondary crown, And when the outer crown slide all over the primary crown, this button will engage completely into a depression already created on the proximal surface of the inner crown, and then we'll get the retention. So this is the additional retention. This is how that TK snap created on the inner surface of the secondary crown, and the pressure will be on the proximal surface of the inner crown or primary crown. Another modified design for double crown, usually this one used in East of Asia like Japan and Korea, which we call the magnetotelescopic crowns. Here we will use the magnet system, attachment system, to get the retention for these double crowns. But the problem with these crowns, after a while, the magnet force will be reduced, then the patients will come asking you to replace this, not the denture actually, to replace the magnet part. Advantages of telescopic system. First, it's going to replace missing teeth, and the good thing, this one, you can use the telescopic denture to replace so many teeth. Even you can use it on only one single remaining tooth in the arch. So also it will improve the appearance compared to clasp retained partial dentures, because most of the time the patients, when you offer him a normal RPD, removable partial denture, acrylic or chronkable, he will tell you, doctor, he's so concerned about the aesthetic, and whenever he smiles, especially if he has a white smile, the clasp will be showing off and he doesn't like this appearance. So telescopic denture can overcome this kind of things, because it's going to be aesthetic and no clasp will be showing off. Also, it will improve the chewing ability of the patients because of the increased retention and stability of this denture. Also, it will provide support to the periodontal structures because of the providing the parallelism between the primary crowns during the fabrications, and the occlusal forces will be applied parallel to the long axis of the abutments, which is good for the periodontal structures. Provision of suitable abutments for removable partial denture, even when the remaining teeth are periodontally compromised. Also, it's easy to perform routine oral hygiene because the primary crown will fit completely on the remaining abutments, and it will protect it from the thermal irritations and the caries also. Plus, the patient will be able to remove and insert this denture, and also he will clean this denture. And of course, we need to enforce the OHI, oral hygiene instructions to the patients. Retention of the removable partial denture is acceptable until one abutment tooth remains. We have a case now, we'll show it, how we replace all the missing teeth with a and only one remaining tooth on the upper arch. Also, the double support on the teeth and gums will distribute the chewing forces equally onto the teeth and gums, thus preventing the teeth from overloading, especially if we are using the non-rigid type of telescopic denture or double crowns, increasing the retention and stability, and the occlusal load to be transmitted well through the long axis of the abutments, because we are providing a unified one single bath of insertion of this denture after cementing the primary crown on the remaining abutments. This kind of denture has a long life expectancy that can serve, actually I saw some cases in the clinic, can serve more than 10 to 15 years, and the patient's still happy with that denture. Also best suited for patients who don't want or cannot have implant surgery due to some contraindications, or he's anxious, or because it's high cost, the implants, some diseases like he's medically compromised, or he's taking medication that will affect the bone that's going to support the receive the implant, so won't be able to insert the implant for these patients. Also, the maintenance, repairing, and modification for this denture easily can be done at low cost. Simply, if the remaining tooth already extracted, we can convert this telescopic denture to be a normal conventional denture. So no need to replace the whole denture for the patients. Also, we'll provide a unified path of insertion, as I said, because we are doing the providing the parallelism between the primary coping on the remaining abutment teeth, even if this abutment teeth is tilted. The option of secondary splinting of for the securing and fixing of loose teeth is still available, because the secondary crown will fit perfectly on the primary crown, and this secondary crown already attached rigidly with the denture base. Also, adjustable retention force. Here, as I said, we can adjust the retention force by adjusting the taper or the convergence angle of the primary crown. So the less taper we have, the more retention we will get. Disadvantages of this telescopic system. First, the high frictional forces acting on the abutment teeth while removing the RPT. This is why it's very important, especially when we're using cylindrical type of double crown. We need to select abutment which is strong and have a healthy supporting tissue in order to absorb the pressure that comes from the occlusal load applying to this abutment. Also, this one required an increased vertical and bacolingual space in order to provide a room for the primary crown, for the secondary crown. Requirement for root canal treatment when necessary, because sometimes we don't have enough clearance to provide the room for this primary and secondary crown. This is why we need to inform the patients earlier and take his consent that maybe we need to do elective endodontic treatments in order to provide more room for the primary crown and secondary crown. This double crown or telescopic denture will wear easily because of the friction between the secondary crown and the primary crown. This is why it's important to select a proper alloy for this crowns. Metal may be exposed in the cervical region, like there's a loss of ceramic facing. Wearing a removable denture might be hard to overcome psychologically for the patients, because it's going to give them a sense of aging. Even some patients, they will not accept to still remove this denture, even it's aesthetically accepted, still can be considered having a crown which is fixed. But the patient will tell you at the end it's this still removable, and it will give me that I'm old already, so it's not going to be acceptable. Double crowns sometimes generate over contoured teeth because we under prepared the abutment. So this is why it's very important to provide a room or space for the material to fabricate the primary crown, then the one for the secondary crown. Otherwise, the aesthetic will be compromised if we got the over contoured teeth. Of course, this kind of system will increase the cost. Primary crown, secondary crown, denture, several appointment needs, so the patient need to be patient. Long treatment procedures, some patient will not accept that one. Complex lab procedures. This is why if you want to fabricate this denture, you need to send it to a high-skilled, well-equipped lab to fabricate it, and this technician, he should have gone to a special training to fabricate this kind of system. Also, this one of the disadvantages also to have a cervical caries due to the dislodgement of the primary crown over the abutment. Aesthetic, because the teeth will look over what they call over contoured or not prepared enough, and teeth will look bulky. Technical problems like fracture of the denture base, fracture of the primary crown, fracture of the secondary crown, loss of retention, many periodic recalls needed for these patients to make sure that the denture is still doing okay, compromised retention during to the wear off between the secondary and primary crown by the time. Indication of telescopic system, it can be used for to replace missing teeth, even if we have a few remaining abutments. Like we can see here in this case, we replace the lower missing teeth, and only we have three abutments. And on the upper arch, we replace the remaining teeth with only two abutments remaining. And here the attachments for this overdenture is provided by telescopic or double crown. Also can be used whenever we have horizontally compromised abutment. In this case, we will use the non-rigid telescopic crowns. Also indicated whenever we have suboptimal distribution or unfavorable distribution of remaining teeth or unparalleled abutments. Especially we'll see this case on the lower arch on the posterior teeth where the tooth, the first molar and second molar already extracted, and then the third molar is basically tilted. Then the patient's requesting to have some sort of fixed denture to replace the missing teeth. At that point, we can consider using the telescopic system to replace the missing teeth. Also, to retain and to increase the retention of the removable bridges. Also, this kind of system can be used with implant technique to connect the implant to normal teeth, because all of us, we know that ideally we cannot connect the normal tooth with the implants. If we want to replace the missing teeth with a fixed bridge or fixed prosthesis. But if you're using this telescopic system, you still can connect. There are some few studies done on this one. You still can connect the implants to normal teeth. When there is a need to crown the abutments, we can go with a telescopic system. Patients with a poor manual dexterity or poor hand skills, because actually, as I said, that this denture will provide the patient with a unified and single path of insertion, so easy for patients to remove and insert this denture frequently. So there's a question always comes to our mind: when to use a framework with a conventional major connector for telescopic system, and when to use just a bridge-like framework without a major connector. Framework with a conventional major connector is indicated in the following situation. First, to replace bilateral posterior and anterior missing teeth with supporting weakened abutments, because here we need to get more support from the gum and the bone. Bilateral splinting of posterior missing teeth supported by one telescopic crown from each side, and also wherever there's an absence of unilateral abutment teeth. So in this case, we need to make our telescopic denture look like a normal conventional denture. So we need to use the conventional major connector. Also, several abutment teeth with unclear periodontal prognosis. That means that these teeth mostly will be removed after a while. So better to have a conventional major connector with our telescopic denture. So when to use the bridge-like framework without a major connector? Whenever we have a numerous periodontally healthy abutment that will enable the reduction of unnecessary bulk of the denture, and the abutment teeth is strong enough and it has a sufficient crown height. Doesn't have short clinical crowns. And also we have a unilateral edentulous area with natural teeth on both anterior and posterior to the area. So it's gonna be like a long span bridge. So we have now the first clinical case. This is a patient. He came to the clinic. He's 65 years old, requesting to replace his missing teeth. So intraoral examination and intraoral picture shows that he has a one remaining tooth on the upper arch and three remaining teeth on the lower arch. This is his OPG or panoramic X-ray, showing there's a considerable, still acceptable bone support for the upper molar, and for the lower teeth, decision been made to retain the molar and extract the other teeth. So the patient agreed to have a telescopic denture for the upper arch to replace the missing teeth, and normal acrylic temporary partial denture to replace the missing teeth. Primary cast has been taken, secondary special tray already fabricated. Then we prepared the remaining abutments, the molar on the upper arch, to receive the double crown. So the double mix, double shot impressions taken to fabricate it. Then and non-precious alloy were used to fabricate the primary crown. You see that the primary crown doesn't have any anatomical features, and the type that we use here actually is the conical type of double crown, which is rigid at the end. And of course, we fabricated the temporary crown to protect the abutments from any thermal irritations, because it was still vital. The crown was cemented into the patient's mouth. Secondary impression with bottom molding done. Then the metal framework fabricated along with the secondary crown. Then tried in the patient's mouth. You can see that the secondary crown has the features, anatomical features. Maxillomandibular relationship recorded for the patients. Smile line, canine line, occlusal plane. Teeth arrangement has been done. We can see the side view that the molar, the remaining abutments, the tooth or the crown is completely metal. The telescopic denture fabricated. We can see that the secondary crown attached to the upper denture and the lower partial denture with the one clasp on the molar. And this is the patient's mouth, the lower denture and the upper denture. Occlusion was perfect. And this is after the insertion, and the patient was happy. Until now, he's still using both dentures. Second case, this is a patient also came to the clinic to replace some missing teeth. He wanted to have a fixed bridge, but the decision been made and informed him that we cannot go with a fixed bridge, because otherwise we will compromise the health of the abutments. And these abutments is not strong enough. So the decision been made to do the telescopic denture for him. Prime impression done, and primary coping or crown cemented into the abutments, the three abutments. Then the framework along with the secondary crowns waxed up on the master cast. Then casted, got the metal framework with the secondary crowns, tried into the patient's mouth. Then after that, after the try-in, we baked the ceramic on the secondary crowns, and the teeth were arranged to replace the missing teeth. And the patient was happy as long as he got some denture that there is no class showing off, and still that can be considered as a fixed removable denture. Third case, this is a patient She's a female, 35 years old. She came to the clinic to replace her missing teeth. Actually, she got a car accident. That's why she got some of the teeth removed. And surgery, the surgeon actually placed a arch bar on the lower arch. So this is the intraoral picture. Decision been made actually not to retain the lower three teeth, 3-1, 4-1, and 4-2. Extraction done for the lower anterior teeth, 3-1, 4-1, and 4-2. And transitional acrylic partial denture given to the patients to be used for a while. Then decision been made to replace the upper missing teeth with telescopic denture with a metal framework, and the lower teeth will be replaced with acrylic partial denture. As we can see here in the picture A, actually this is the transitional partial denture already given before. So the crown prepared. So the crown, three crowns were prepared: tooth 1-5, tooth 1-3, and tooth 2-3. Then primary crown fabricated. Then we use the secondary impression to fabricate the metal framework along with the secondary crown, and to replace this denture, the upper telescopic denture used to replace the posterior upper teeth also. Secondary crown were baked with the ceramic, and teeth arrangements done for the patients, tried, and then the denture completely processed. And we can see that the upper missing teeth were replaced by telescopic partial denture, and the lower teeth replaced by chrome cobalt partial denture, and the patients was happy with the results. So as a conclusion, telescopic denture, as we said, can be considered as a viable, excellent treatment options and modality. I hope every dentist can offer his patient this kind of treatment options. And also it will rectify the aesthetic, as there is no clasp will be showing off, and the patients will be happy to have this kind of denture. Retention will be provided by the type of this double crowns, and this denture have a high survival rate. Some studies shows that it has a survival rate of over 95% after 6 to 7 years, and also it will maintain the oral hygiene of the patients, as he's going to be able to remove and insert the denture frequently. Thank you very much. This is the end of the webinar. I hope you enjoyed it. Thank you very much.
Thank you very much, Dr. Noor, for enlightening us on this, and hope the viewers have got proper insights on this particular topic. And also, the good part is the video will be there in our MASA Facebook, both in the Faculty of Dentistry as well as the main website of our university. Also, it will be available in the YouTube. So, those who have missed the live session, please come and visit it in the Facebook. Those who are watching, please convey to your friends. Okay, thank you very much, Dr. Noor.
Thank you very
And
much. It
we
was my
have got
pleasure.
one question from uh, Sandra Natha. And yeah, the question is, first of all, he has conveyed thank you. Thank you very much for watching as well. So the question is, how much is the tooth prep or space requirement to allow sufficient thickness of the primary coping as well as secondary coping plus porcelain facing? So
Uh,
that's what the
yeah,
question
yeah.
was.
Thank you very much. This one actually required at least 6 to 7 millimeter, 6 to 7 millimeters to get the room for the primary coping and the secondary coping plus the ceramic.
Thank you
Yeah.
very much, Dr. Noor. Hope
Thank you.
Sandranathan has got the answer. Next, we have got the question: what is the ideal type of metal for the primary crown and the framework?
Ideal metal.
Yeah.
Actually, we prefer to use the precious or noble alloy to fabricate the framework for the denture base and also the primary crown plus the secondary crown.
Okay.
Yeah.
So that answers the question. Thank you very much, everyone. Thank you, Dr. Noor, once more. Okay,
Thank
so
you.
let's
My
call it a
pleasure.
day. Thank you
Thank you
very
very much.
much.
Thank you very much, doctor. Thank you. Thank you. My pleasure.